About a year ago, I was chatting with a friend during breakfast while in training for a different type of aircraft, and I said, "Marty, where you been? I haven't seen you for a while." And he said, "Well, I had some cataract issues." And I said, "You know, that's probably a good incentive. I probably better go see my optometrist, because it's been a year and a half or two." And a few weeks later, I'm at the optometrist, and he goes, "There's something in your eye." Which I said, "So what's that mean?" He says, "You need to go see a specialist." So I saw the retina specialist in Anchorage, and he said, "It's probably uveal melanoma." He said, "You need to go see Amy." I says, "Who's Amy?" He says, "It's Dr. Scheffler in Houston."
So these are very rare tumors. There are only about 2,000 new diagnosed uveal melanomas per year, which is the most common malignant eye tumor in adults. And so as a result, there are very few excellent centers around the country that take care of these patients, and we're one of the very few.
During my first visit, Dr. Scheffler, they ran a whole bunch of tests. She said, "Yeah, it looks like a melanoma, but I can fix this." And those are the words I waited to hear.
So this is truly a team approach, as I say, in this modern era of personalized medicine. Each one of us here at Houston Methodist Hospital have our own expertise. I am a trained radiation oncologist, and Dr. Scheffler is a trained ocular oncologist. So we both will see the patient as a team.
So every member of our team, on the eye cancer team, is very, very subspecialized in what he or she has been trained to do. So our radiation oncologist is an expert in specifically the radiation of eyes and has done specialty training in that. Our radiation physicists have had extra training and expertise in doing specifically radiation physics for eye tumors. Our ultrasonographer is specifically trained to do ultrasound of eyes. Our pathologist is trained to do pathology of eyeballs and so forth. So every member of our team is very, very subspecialized and interested very specifically in just these diseases.
So the first thing come to the mind of the patient, as you said, is certainly very scary. It's a new diagnosis, it's in the eye. The first thing that come to the patient's mind is, "Oh, I'm going to lose my eye, I'm going to be blind. What am I going to do? I have a career, I need my eyes to work." So now, the first thing we talk to the patient when we see them is, first, we have to make that diagnosis. Our ocular oncologist, Dr. Scheffler, certainly can do the biopsy before we perform the treatment procedure. And then we make the diagnosis intraoperatively, as in the OR, with the presence of our ocular pathologist here at Houston Methodist Hospital, and we can make the diagnosis before we proceed with the treatment. One of the things that we are working on is collecting the tissue. Dr. Scheffler, intraoperative, as I said, will take some tissue to make the diagnosis, but at the same time, we also look at what we call genomic profiling, or the molecular makeup of these tumors. And more information we are finding there, although under the clinical exam it looked the same, which is all ocular melanoma, but in the genomic or molecular signature, they are all different. So we are hoping in the future of molecular era or molecular oncology, we can profile all this tumor, and each of these melanoma may be treated slightly different. For example, one type may need a little less radiation, the other one, more aggressive one, may need a little more radiation. So again, then we can offer personalized radiotherapy for this patients, with different molecular signature of the ocular melanoma. Our goal are threefold. The goal of this, our ocular eye plaque program, is truly first to cure. This is cancer, we need to cure. That's our first goal. Two other goals, just as important, especially affecting quality of life, is to preserve the eye. As I said, alternatively, you have to go through surgery to remove the eye. And the third is just as important, is to preserve the vision in these patients. So here at Houston Methodist Hospital, we aim and we go all out to achieve all three goals of curing, preservation of the vision, and also preservation of the eye.
Every stage of the patient's care, everything is tailored very, very uniquely to the unusual aspects of these diseases and how they need to be taken care of. So for example, when we put our plaques on the patients with eye cancer in the operating room, it's like a disc with small radiation beads that we sew on the surface of the eye. When we put that disc on the surface of the eye in the operating room, we perform an ultrasound with our specialized ultrasound team right afterward to confirm that all of the margins of the tumor are fully covered with the plaque. And as a result, we have almost a 0% rate of recurrence of the tumor. And so there's small attention to details like that that a very expert team enables us to do that other centers don't have.
On the day of surgery at Houston Methodist, I reported it was an early morning, and I was told to expect an hour to hour and a half surgery. Everything started right on time. It was very efficient and straightforward, and I was very impressed as far as the ease of and the apprehension that was made to go away basically by the staff. They're very, very comforting because they understand that it's not something you're doing for fun. You know, it's a serious issue, and hopefully with a good outcome.
And then, of course, one of the things that we do long term to help make patients' anxiety lessen is we follow them. And so we don't just treat the eye and say, go on your merry way and find care in the community. We actually take care of our patients forevermore. And that means not only managing the eye, but also helping them manage all the other things that go along with the diagnosis of cancer, coordinating their care with oncologists, with radiation oncologists, making sure they get the scans and other surveys that they need every year for the rest of their lives.
Go get your regular eye exam. That's what the reason is for, is not necessarily to see if your vision's changed, of course that's part of it, but is they have new machines to take pictures of your eyes, and they can catch these issues that may come up with your eyes before they get serious.